telehealth as a way for us to reach out to people where they are, and not force them to always come into our schedules, our timing, and that sort of thing.
The ability to get concrete data using these telemonitors is really important. It's really important too to be able to see trends over time and kind of how patients are doing over the weeks. It's been really exciting over the last 2 years. The dynamic is just totally changing in the way we collaborate.
As there's a huge move towards community health and trying to make the community as a whole healthier, we're having to reach out, not just wait for people to show up on our doorstep.
Telehealth is a way of interacting with patients that are at home and communicating to their healthcare provider using technology.
Telehealth has made my job easier in taking care of my patients and knowing that, like, what their blood pressure is on a day-to-day basis.
Well, they could see for sure if their blood pressure is high or low, or things like that.
But it is beneficial in, knowing all those things.
So we have a tablet, and every day it comes on and it asks them to record some vital signs. It can be blood pressure, oxygen, their heart rate, their weight.
It can ask questions and patients can answer those. We can also do video and actually see the patient in their home and talk to them directly.
Then we use that information when we get it from patients to see how they're doing. If we see things that are concerning, we call them. And that's where the real collaboration between the patient, the provider, and the care coordinator happen.
Traditionally, you have somebody that you see maybe every 3 to 4 months. Having this as an option to get more immediate feedback, I can make an adjustment in their blood pressure medicine and not wait 4 months before I can make the next adjustment.
I think the technology of the telehealth has made the patient's life easier because they can do it right in their home.
Well, it's not hard at all. I have had help from the nurses, that came in, and they've been very nice. And I guess the first time I did it, I knew how to do it then.
People that have difficulty getting out easily get that nurse feedback a little quicker maybe than what they get just from our office conversations.
The goal of the program is that, one, they'll do really well while we're taking care of them, but also they're learning all the time about their condition, and we're setting them up to be able to do it on their own.
I think for the patient, it gives them a sense of security that they've got another way, another avenue of connecting with healthcare in a more speedy fashion. And for us, it's a way of connecting with more information. So I see lots of benefits because the more options and availability we have, I think the easier it is for patients to reach out.
There's an openness for innovation that there's never been. There's an excitement about, let's try something new to really help patients, and let's do it together, and let's do it across the continuum, and let's collaborate with community partners. I think it's going to improve quality of life for the patients because they're getting access to services that they didn't have. It begins to build together to really create health in our community.